Alexander begging for change, the healthcare blues. This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Juan Gonzalez.
Well, I want to turn to President Obama. On Wednesday, he spoke with Bill Clinton at the Clinton Global Initiative Conference.
And essentially what we've done is we've created what we're calling marketplaces in every state around across the country, where consumers are now able to be part of a big pool. Insurers have to bid, essentially compete for the business of that pool. And what we now have set up are these marketplaces that provide high-quality health care at affordable prices, giving people choices so that they can get the health insurance that they need and they want, and the premiums are significantly lower than what they were able to previously get. I'll take the example of New York State. The insurers put in their bids to participate in these marketplaces. It turns out that their rates are up to 50% lower than what was available previously if you just went on the open market and you tried to get health insurance. 50% lower in this state. California, it's about 33% lower. In my home state, Illinois, they just announced it's about 25% lower.
That was President Obama at the Clinton Global Initiatives Conference. We're here with Elizabeth Benjamin, Vice President of Health Initiatives at the Community Service Society of New York. What about these lowered premiums here in New York State? How was it accomplished? And also, could you talk about the different levels of coverage that people have access to? Because depending on the level, the premiums rise substantially.
That's true. So the reason why costs are lower, and I think the best way to think about it is kind of like a Costco. What you have here is you have the ability, because of the mandate, more people are coming into the market. Insurance works on a solidarity principle, or like a Costco. The more people that go, you have bulk purchasing. If things are bulk purchased, it's highly discounted. And so that's what happened in New York. Right now, if you go on the open market in New York, you're paying over $1,000 a month for one person to get health insurance. The lowest prices on the exchange is like $200 before financial aid. So it's really an extraordinary thing that we've been able to pull prices down so much. Going to your second question, which is there's these different tiers, right? First of all, maybe there's two different things that are happening at once that affect prices. The first thing that's happening is you get financial aid based on your income level. So the people that are poorest, like $15,000 for a family of one, those folks will go into Medicaid. But as you go up the income band for one person up to $45,000, there's really, really good financial aid. Now, obviously, the most financial aid goes to the most needy, the people that say 200% of poverty, and the least amount of financial aid goes to people at 400% of poverty, so $45,000 for a family of one, or $94,200 for a family of four. So it depends on how many people are in your household. So they'll figure out what your financial aid amount is based on how many people in your household and how much income you have. And then you take your voucher, if you will, your financial aid, and you can apply it to the cost of premiums every month. Now, what premiums do you, but there's different premiums, right? Because some plans are
but how does that voucher work? It comes directly off the premium that you have to pay? Or
yes.
Do you have to pay it first and then get it rebated?
No, there's two ways you can have it. First of all, you can just say, apply it to the cost of my coverage, and your coverage will be discounted automatically. And so then you just pay whatever's remaining to the carrier every month. Or you can say, I think I might be getting a big raise. My income's too unstable. I'm just going to do it at tax time, and I'm going to true up a year and a half later, or a year and a quarter later on April 15th. So it really depends if you want to take it now or take it later. So going to your second question from before, there are different value levels for the insurance companies, and they're ranked. Each insurance company will have a bronze offering, a silver offering, a gold offering, or a platinum offering. So obviously bronze is not as good as platinum, just in the metal tiers. And so for bronze, you'll be expected to pay about 40% of your costs all together. It's not every time you go to the doctor. And the insurance company pays around 60%. At platinum, you pay less than 10%, or for example, $200 ever in the whole year. In New York, that's our platinum product. And the insurance company's paying the other 90%. So that's really, the fancier the plan you get, the less you pay when you go to the doctor, but you pay more on that monthly bill, right, to pay for, because it's fancier, it costs more. The other thing to remember is that even if you go for a bronze plan, there's this incredible thing in the Affordable Care Act that you will never have to spend more altogether, deductibles and cost sharing, than, say, $8,000 a year if you're at 400% of poverty, or maybe $4,000 if you're much lower income. People don't go bankrupt for $4,000. People don't go bankrupt for $8,000. Under the Affordable Care Act, we will see medical bankruptcies go away. Just sort of amazing thing.
One thing I wanted to ask you, because in the existing insurance, those of us who have it, we are bewildered constantly by the copays and the deductibles and the donuts, and you can never figure out exactly what your payment is supposed to be. How will this function under the Affordable Care Act?
So you will have two different forms of payments. Number one, you'll have your premium payment on a monthly level, and then you have what we call cost sharing when you go to the doctors. If you have a very inexpensive plan, you might also have a deductible. A deductible means you have to pay a certain amount. Usually in the platinum product, for example, it's $200. In a silver product, it may be as much as $1,000, although there's special cost-sharing protection for very low-income people in the silver product. So you have to pay that before your insurance kicks in. The good news is those deductibles don't apply to things like primary care, preventive care. In New York, it won't apply to drugs. So there's some real protections for people on the deductible side. So there's the monthly bill, and then what you pay when you go to the doctor.
Give us some example of people who are going to go to the system.
So we like this example of Angie. She just graduated from college. She lives in Queens. She's making $28,000 a year as a graphic designer. She decides to go, she's at 250% of poverty at $28,000. So she's not really eligible for any special cost-sharing protection, but she is eligible for a significant monthly coupon. Her monthly coupon or discount, financial aid, whatever you want to call it, is around $176. If she goes for a bronze plan, which is around $300 in Queens, she will get $176 discounted off of that. So the most she'll spend a month is $162.
Ask someone else.
So we have a family of 4 in Brooklyn. They make around $47,000. The wife is a independent freelance photographer. Husband just got laid off. They used to have job-based coverage. Say it happened mid-year. If you get, we should talk about the enrollment periods, but if you get laid off mid-year, you can go into the exchange during the year. If there's good reasons, you can go into the exchange. Otherwise, you have a strict period.
So let's talk about that. October 1st, if you sign up, you get your health insurance October 1st?
No, you get your insurance starting January 1st. The coverage starts January 1st, and this is the only year where you have that gap. So you start shopping in October. It's called the open enrollment period. You have until March 31st to voluntarily get into a plan. If for some reason you don't do that, maybe a job-based coverage, and then you lose job-based coverage in July, then you can get into the exchange and get financial aid.
What if you get hurt in April, so you decide, oh my gosh, I need insurance?
Then you really might be out of luck. You won't get the financial aid.
But talking about pre-existing conditions now, that's okay?
Yeah, there will be no pre-existing condition exclusion anymore.
And of the 48 million, roughly, Americans that don't have health insurance, how many are expected to actually be covered by the Affordable Care Act?
Well, it's a little confusing because of the Medicaid wrinkle that the Supreme Court did, but originally they thought it'd be 15,000 people in Medicaid and around 15,000 people getting financial aid. What I do know is that 3/4 of the people that go to the exchanges, at least in New York, will be eligible for some kind of financial aid or Medicaid.
3/4 of about, what, in New York is about 2.3 million or so?
No, there's 19 million people in the state, 2.3 million are uninsured,
right.
And so they're expecting about 1.1 million people to go into the marketplace.
Elizabeth, I want to turn to a new ad on the Affordable Care Act that's produced by Generation Opportunity, an activist group with funding ties to the conservative Koch brothers. The video shows a nurse escorting a young woman into an exam room for a gynecological exam. For our radio listeners, I'll do some narration for the parts you can't hear.
Oh, I see you chose to sign up for Obamacare.
Yeah, it's actually my first time here.
Well, here we are then. Change it to a gown, and the doctor will see you soon.
Okay, well, your vitals look good. Any changes in your diet or exercise? All right, can you swing on over, scoot on down, and try to make yourself comfortable? Okay, let's have a look.
The doctor walks out of the room. The woman's alone with her legs up in stirrups. And all of a sudden, Uncle Sam pops up between her legs. She screams. The note here says, don't let the government play doctor. Opt out of Obamacare. And he's holding up a speculum, and it says, opt out again. So, Elizabeth, the debate that's going on in Washington and what it means to say opt out, is it possible this won't happen, that the Republicans will succeed in preventing the October 1st opening of the marketplaces from happening?
Absolutely not. The marketplaces are up and running. The beta tests have been done. You can go in already and start playing with your income amount. And October 1st, there will be plans up, and you will be able to start doing comparison shopping and qualifying for financial aid. So,
and reproductive health care for women, how women choose what's covered if they can go to the clinics of their choices?
Right. Well, one of the things that's really nice about the Affordable Care Act is, that most plans will offer, reproductive health care, and you'll be able to have, contraception and no copays, and it's really an extraordinary thing.
That's new under the ACA?
The Affordable Care Act, correct. It's considered preventive care.
And it happens no matter what. With the debt ceiling, it happens no matter what.
October 1st, the marketplaces are paid for. The insurance plans have made their, as the president, they basically laid their bets. They've dropped their prices. They think people are coming in. The insurance industry, I think in this case, really understands what's going on. And for the insurance industry to drop their prices by over 50% in New York State means it's going, full steam ahead.
And in California?
California, they say over 30%.
Oregon?
No. I thought it was over 20%.
And Elizabeth, those Americans who choose not to participate in the Affordable Care Act, what are going to be the penalties, and how will they be assessed? And since this is now a requirement for individuals.
Yeah, I think they start the Affordable Care Act. Gets that people, not everybody may be able to do it at once, right? So, and they really expect sort of a phasing in of participation. So the first year, the penalty is relatively small. It's $95 or 1% of your income. So that's not a lot of money. And how that would be levied, if you will, would be not this coming April 15th in 2014, but in 2015. So it's a year and a quarter away. And so you really, you have to show that you got some kind of coverage next year, and then you can avoid paying that penalty.
And in subsequent years, it's expected to rise?
Yes, it goes up to, for example, 2%, a maximum of 2% of gross family income, and then 3%.
Elizabeth, I want to thank you very much for being with us. Community Service Society is her organization. She's Vice President of Health Initiatives there. And again, if people want to get in touch with Community Service Society, can they call from other states?
They can. We would probably send you to healthcare.gov. I think it's better if you live in another state to go to www.healthcare.gov. They also have a toll-free number with live answer operators. It's right there on the website.
So you can be directed to a person who will help you navigate through this.
Yes.
And the Community Service Society number?
For people in New York, it's 888-614-5400.
Elizabeth Benjamin, thanks so much for being with us. This is Democracy Now!